Hey guys, what's happening? So we're back with you in the middle of the day because this is big news. We talked about Oropouche virus a couple months back. Now it's back in the news again. This time it's in Barbados. They've confirmed two cases. There's no treatment for this. It's almost the same as in the mosquitoes that deliver dengue. So you have to be on alert. Ensure that around your yard, wherever you are, there's little water, little contamination going on, whether it be tires, drums. Get rid of them because you have dengue. Plus, you have Oropouche. There's a lot of viruses. They've been around for a long time, but they're now popping back up a lot. And we're going to show you a map. Currently, this is where, if you notice in this map, you would see that they're currently in these areas, and this is South America largely here. Human disease cases 2023, 2024. Bolivia, Brazil had in 2024 as well. That's reported cases in Peru. All these South American nations, all the way up to Guyana, which had reported cases in the last 2 years, just 2024, down there in Brazil as well, in the Dominican Republic, in Cuba. Now we are hearing about cases in Barbados, in the Cayman Islands, and so on. We'll tell you all about that, but it's spreading. And that's the whole thing about it. So let's get into the information that we have about the Oropouche virus and where it's currently located and why you should be concerned. Concerns in the Caribbean as Barbados confirms two cases of Oropouche virus. And that, my friend, is a cause for concern. Remember, there's no treatment for it. Concerns are being raised in the Caribbean following the confirmation of two adult cases of the Oropouche virus in Barbados last week. OROV is the emergent disease that is transmitted by mosquitoes and midgets that has been gaining attention from the Centers for Disease Control, CDC, and other health agencies. In announcing the cases, the Health Ministry in Barbados advised residents to adopt protective measures against mosquitoes and insect bites to prevent contracting the OROV. Remember, I told you around your homes, whether it be drums, rubber tires in the road above you or below you, whatever it is that contains water, you have to be rid of them as quickly as possible. So that was the first time that the disease was detected in Barbados, and already some Caribbean countries are scrambling to find preventative measures since there are similar environmental concerns and vector populations present in all the islands. So all of the islands are basically under threat. Okay, there's travel between the islands; it's very close by, so you know. Media reports indicate that the Ministry of Health in St. Lucia is expected to address the matter by outlining plans to address the risk of disease among residents. Among plans on the agenda are surveillance measures, public education campaigns, and the distribution of resources to help communities combat mosquito and midget populations. Midget populations. The thing is, people are saying that they're spraying, but the mosquito is not working. They're just coming back just after the spraying is finished. So we have to get measures ourselves, implement measures ourselves. You can go online, Google, you can look for a ton load of measures you can find for that. But I must warn you, the basics are just ensuring that whatever water containers are around, which they're breeding, the mosquitoes breed into, get rid of them. Now, they're saying that according to the WHO, between January the 1st and November 25th, there have been 11,634 confirmed cases, including two deaths in the region in the Americas. Caribbean countries with confirmed cases are currently Cuba with 603. That's a lot. Guyana has two, Barbados has two, and one imported case in the Cayman Islands. And so this is a cause for concern. It is a risk if you have a lot of mosquitoes around you. So you have to be very careful. All right. So they're saying that it's crucial due to the expansion of the virus transmission area and the growing need to better understand the disease spectrum, including possible new transmission routes, new vectors that could affect both the general population and vulnerable groups such as pregnant women, their fetus, newborns. It is sad. Now remember that these things, there is no cure for this one. All right. Who pointed out that symptoms of ORV are similar to those of dengue, starting to 4 to 8 days, up to between 3 to 12 days after a bite when infected mosquito or midge. So the onset is sudden, usually with fever, intense headache, joint stiffness, pain, chills, sometimes persistent nausea and vomiting for up to 7 days. It is said up to 60% of the cases have a relapse of symptoms after the fever stops. Most cases recover within 7 days. However, in some patients, convalescence can take weeks. Severe clinical presentation is rare, but it may result in a septic meningitis during the second week of the disease. So, guys, please do what you have to do around your own home. Prevention is better than cure, as they always say in the Caribbean. Remember to look out for that. It is necessary. So pay attention to your health authorities and the islands. I know many if you don't trust these guys anymore since the last plan, nah, them. But remember, they give advice as well. You can do your own research as well online and see what you come up with. So we're gonna keep a tab on this. It's spreading in the Caribbean, and the Caribbean is on high alert. So as always, share, like, subscribe, may leave your comments in the section below.